Hello everyone, Dr. Deke4B. We are going to be discussing dementia further. On our last video, we talked about stages 1, 2, and 3 of the global deterioration scale. And today we'll talk about stage 4 and 5. So I'm just going to do a quick recap of the first 3 stages. First stage, the best way to remember it is to remember no, because no signs of dementia outwardly. Inwardly, there's a lot going on in the brain. Second stage, remember it as you. You are beginning to notice some little signs, and you're beginning to notice that this is a little more than the usual aging. You're becoming a little more forgetful, misplacing things. You may be having challenges remembering your appointments, but you're functioning well, and there is absolutely no effect, really, no impact in your quality of life. And then we get to stage 3. Stage 3 is that mild cognitive impairment, and that's when most people can be tested. That's when most people notice that there's a little more going on. I call it the noticeable stage because people around you notice that there's something not right. You're having more challenges at work, you're not performing as well. And a lot of people seek medical help at this stage. If you do and you have testing done, it can be noted in testing. All right, so we move on to stage 4 today, which we'll be talking about stage 4 and 5 today. And this is really now the early stage dementia, and we're beginning to see symptoms. It's beginning to have an impact in our life, albeit little impact. You still recognize your loved ones, you still recognize your family members. However, you're having more challenges with finances. You're having more difficulty with problem solving. You're having difficulty with driving. This is a stage where you get to a red light and you don't remember, does red mean stop or go? Or you get to a stop sign and you don't stop. So it's becoming risky. It's a difficult stage. And you're also more uncomfortable in familiar places. If you were to go to Florida to visit some family, you get totally lost. Or you're in a hotel, you don't remember. It's not a familiar environment. You don't remember the basic things, and you're having more challenges. You're also having challenges with words, and you're thinking of names of things. That thing you put on your finger instead of a ring, that thing you write with instead of a pen. So you're trying to describe the word because you don't remember the word. Problem solving is a major difficulty, as I mentioned, and also family members are noticing that you're misplacing your car keys, you're misplacing your eyeglasses, you're looking for things constantly. This is a stage where family members need to pick up and start driving you. They need to stop you from driving. They need to pick up and help with activities of daily living at this stage. And this leads us to stage number 5. Which is the mid-stage dementia. Remember, we have a scale of 1 to 7. So stage number 5, there is beginning to be moderate, severe mental decline. It is really now the moderate dementia, and it's beginning to impact your quality of life moderately. What do we notice at this stage? Mood changes, very significant personality changes. Somebody that was outgoing becomes not outgoing. Somebody that was not outgoing may decide that they want to go out more. There's marked irritability. Hallucinations can be seen where they're seeing things, and a lot of delusions where they think that things are happening. Examples of this are delusion of infidelity, where the spouse is accusing the wife or the husband of being unfaithful, and no matter what you do, you can't convince them otherwise. So this becomes very challenging for the family member that's dealing with this. Is becoming really a difficult thing. The patient is becoming confused about dates and time and address and phone number. They don't remember sometimes even how to use a phone. They have to think about it. Things that they do normally, they go to the bathroom, they don't remember to flush the toilet. They come out, they don't remember to wash their hands. And some of them start having difficulty getting dressed, not putting on clothes, but difficulty dressing appropriately. So it's freezing outside and they put on shorts, and then it's very hot and they put on a winter coat. They don't remember that they have to dress a certain way to go to church. They sometimes put the shoes on the wrong foot. So they require help now with things like that. They're becoming a little more dependent on the family members and losing some of their independence. At this stage, the family members need to completely take over the finances, take over major decision making, and above all, they need to exercise a lot of patience. This is a difficult time for the family. This is a difficult time for the patient because they know that something is not right. So this leads me to, again, getting to the root of dementia and preventing it. For the first 3 stages, we can definitely prevent it, maybe a little bit on the 4th stage, but at this point with the 5th stage, there's not much we can really do to reverse this disease. The reversal could have been done in stage 1, 2, 3, maybe 4. Stage 5, absolutely not. So if you're interested in finding out ways to reverse dementia or prevent it to begin with, this is the time to start working on it. And I can tell you how and show you how. Inbox me, contact me. I will see you in the next video when we talk about the late stages of dementia, stage 6 and 7. Dr. Deke Fobi, I'll see you then.